Okay, well, hello everybody, and welcome to this edition of the HSO UK Expert View interview. My name is Matt Birdsall. I'm the Manufacturing Industry Director here at HSO. And it's my pleasure to welcome Bill Burke, who is the CEO of Merit Solutions. So, welcome, Bill.
Thanks, Matt. It's great to be back.
Yeah, no, it's great that you're able to join us because we've got kind of well, it is a really interesting topic and one that is certainly getting a lot more exposure within the industry. But this is how we utilize AI technology in a regulated environment such as pharmaceuticals. As I say, it is very topical. There are some challenges, and I think what I'm really interested in this short period of time that we've got is getting some understanding of how we can use this technology that's going to help us to do the things that are so important, which is we're still going to be compliant, we're still going to be very mindful of quality, and of course we want to be efficient in the way that we do things. So yeah, I think we're not going to get into everything, but I know we've got a great topic in front of us.
Mm-hmm. Yeah, no, it's an exciting time, and I think particularly for regulated companies and regulated industries, there's a huge leverage, and so but there are some do's and don'ts. There are some aware things about the FDA and awareness, and I think there's some ways to think about this in terms of waves as well. We can get into a little bit more of that.
Yeah, yeah, yeah. I mean, I think maybe just to open things up. I mean, the Core Dynamics D365 platform has a huge amount of AI technology now incorporated into that. Merit providing the solution for life sciences and the expertise that goes with providing all of the functionality and capabilities that are needed in that. So, how have you, in particular, addressed this interaction of AI, sort of leveraging what Microsoft are doing, but also with the lens of, we're in a regulated industry, there are things that we need to be accounting for?
Yeah, that's the great question, I think I'd start by saying that the base architecture and the base approach that Microsoft has taken is phenomenal. So for Merit, as you know, our software, it lives inside of Microsoft ERP to address these workload areas of material control and compliance and controlled procurement and planning related to supply to quality resources, batch release, these kinds of things that FDA regulated companies have to consider maintaining validation. And so we're if you go down into the Microsoft approach to AI and then you look at the way what it's enabling for Merit, it's phenomenal because there's this base general idea that, okay, you have to get your data. This idea of siloed data is very, very bad when it comes to AI because AI, LLM, it's a language model and it wants to relate data together. And so Microsoft has this idea of a data lake, which is where you want to bring your data. If you're in a Microsoft world, you want to bring your data together into a data lake. But they've also enabled this idea of it's called a semantic layer. So it's essentially the ability to get your data into a data lake, but then to describe your data in a way that AI can interpret the data. We have to remember that large language models, that's a different model of computing to the one that we all grew up in. We all grew up in SQL Server relational databases, and so data goes into tables and it's hard related to other tables. And if you're an LLM, that's a problem because you don't want to read PO001XT2 and try to figure out how that relates to the other 18 tables that are related to a purchase order, right? You need a language that you can interpret. A large language model is essentially a huge math model put on top of words and how they relate to each other. So it's exciting to us that Microsoft has sort of figured out architecturally how do we move that data out of whatever form it's in. In the case of us, it's relational data. How do we move that into a data lake? But then how do we enable a layer that allows us to tell AI how to interpret the data in that data lake The old way was we built a data warehouse and we sort of did the same thing we did with relational databases. We hard coded in how the data related. Now there's a semantic layer. And so that's a little bit about how we're taking advantage of at Merit what Microsoft has done with Dynamics. And we're doing that with our tables and our data to enable these use cases for regulated industries.
Okay, and when we think about then the use of AI within D365, I mean, Copilot is everywhere in that. It's embedded in there. It's the main tool. You go and ask your queries. So what you're saying is that in the same way that Microsoft have done the things that they need to do to make that effective, you've just done the same thing, so it will just work seamlessly. You see, is that effectively what we're saying there? So all of the things, you want to run chatbot queries or you want to run just general, Q&A type queries, then you pull the answers back.
Exactly. Yeah. That's part of it. And then also in Merit, we have an additional part of Merit is related to training and certification, change management, as well as controlled document. And so that data is not in ERP relational database tables. That data is in PDFs and Word documents and Excel, but it's in a controlled environment that also has per 11 and per, electronic signatures and audit trails around it. But that's really important data. Typically, companies are using that for their SOPs, for example, using for their training and certification. Those are connected to ERP. They're connected to the Merit part, for example, that would say, "Hey, I have a person who is going to perform this work inside this clean room, and I need to verify that she is certified to do that. She's trained, she's signed off on, she's viewed and accepted the SOPs before she can go in that clean room." So for us, bringing AI into the picture involves sort of all the things that you think about in D365 ERP, but also all the things that are in the we call that unstructured data, controlled unstructured data as well. And it gets really interesting when you start to look at that because you can start to use AI to do things like say, okay, I want to see all of the places if I make a change. For example, I want to replace this mixer, change control, and put a new mixer in. What are all the considerations that I have to think about from a change control standpoint when I put this new mixer into this production arm? Well, some of those changes are going to be things we have to change in our SOPs. Some of the impacted areas might be the training and certification on that. Of course, some of the things will be like what other equipment relates to that, what types of procedures and work processes do we have just upstream from that in the dispensing area, right? So we can start to use AI to assist us in productivity. And in the old way, we would say, okay, I need somebody to come around from quality and go figure all that stuff out manually, right? Go talk to the document control folks and figure out what are all the SOPs that have this mixer and anywhere in it, right? Go figure out, go talk to the production folks in the dispensing area and say, what dispensing rules do you have that kind of relate into this production room that are going to relate to this mixer? So think about it. Now we can start to use AI to go do that for us. It can produce a pro forma of, hey, here are the 14 areas of change impact, right? By the way, these SOPs need to be changed. Here are suggested draft SOPs with the new mixer. We still need a human. The FDA is going to not be happy if we just let AI change that SOP. We still need a human change it, but AI can now say very easily, hey, I've taken the old SOP. I've got the new, contextual information about what the mixer is, how it's different, what specs are different. Here's my draft. I suggest this is a new SOP. So it starts to get very interesting for us to be able to use AI across sort of all the areas of Merit for Life Science. Yeah.
Yeah, no, I can certainly see that. I mean, you're touching there on areas around, conformance, obviously things that are impacting on quality, the productivity gains. I mean, I was just thinking as you were talking, but the whole sort of the tracking of the batch records. I mean, there's typically so much manual paperwork that is captured in spreadsheets off system, but obviously with this sort of technology, we're able to run those queries and say, pull all of that together for me
Yeah.
at the end of my production process. Yeah.
Yeah. That's another really interesting area. We think about that as like batch release, and today we have batch release capability. It says, hey, here are some things that you need to make sure, let the system verify any quality orders related, but there are other things that are done manually that we think AI can play a big role in. It gets when you start to add up all of these 100 different areas that we can start to apply AI. You start to make real productivity differences.
Yeah. So I guess that begs the question: what are the challenges that any regulated industry in the life sciences space is likely to face, and how do you go about help solving some of those challenges?
Yeah, it's kind of funny. We recently had a discussion with our products VP, and we both have now kids that are in college or up and out, but those kids learned how to do Google searches when they were in like high school and grade school, right? And what he said is, I think the kids now are going to learn how to do prompt engineering in like grade school and junior high, because that's kind of the new thing. So that the ability, like one challenge is, if you look at customers that are adopting AI right now, that the first step that they're taking is that we figured out we need to teach our people how to actually train them, build prompt engineering, so that when we're asking an LLM to go figure something out, we're asking it the right way. We're sort of boxing in what we're asking, right? Otherwise, we start to get different answers that don't really help. So I think that's kind of the one thing is getting that just level of understanding of and what I mean by prompt engineering is, how do I write the questions to the LLM in a way that structures it, because it's gonna do better if I give it a narrower set of requests, if you will. I scope it in kind of what I'm asking it. So that's kind of one people challenge that'll just get solved. That's already getting solved. I'd say for sure, thinking very carefully about not letting your data get out into the wild is a top priority. And so what I mean by that is, you could never have a chatbot enabled to a customer, for example, to ask, hey, what is the status of my, I'm a medical equipment manufacturer. What is the status of my order? Where is it at? And show me some of the initial quality specifications and related to the, this serialized equipment that you're going to be shipping me, and when do I expect to get delivered? You could never have that chatbot be able to go in and then go look at other customers or something of that nature. And even worse, you would never want information to get out beyond your data, your four walls of your data, into like ChatGPT 4.0's, wider data set, right? So that's happened, and it's happening in some cases right now. And so I think that's something to think very carefully about. It's a lot of the reason why we see customers driving towards Microsoft. I think Amazon has a good story around this and our architecture around this too. But the ability to hold your data, inside your tenant and never let it get out, and then the rules around data even inside that for what you enable. That's just a very important area. I think Microsoft, the Dynamics folks, are thinking very hard about that, and doing stringent engineering around that, and we are as well. And then I think another challenge is just looking at the regulatory bodies and where they at on what they'll want you to do or not do. And I'll just say today, the FDA has a love-hate relationship with AI. They're seeing it that they love it when it's helping people be more productive. They're really concerned about it, the idea of letting AI make decisions that could harm or kill humans, obviously. And so at what point will the FDA be very supportive of you using AI? Well, there's a lot of focus around medical device with onboard AI right now. That's kind of the first focus. So if there's a pacemaker that's using AI to try to be deterministic about data that's picking up off the body and make, decisions, well, then they want to make sure that, that AI is a predicting machine. It's not a deterministic data, sort of machine. And so I think the FDA, if you look at the white papers that are out right now and they keep publishing them, and other regulatory bodies, EMA, right, others, they're conversations. They're not yet forming into rules or even strong guidance that companies can pick up on. And so I think the prudent path is I'm using AI for things like recommendations, but I have a human in place anywhere that there's a true a risk process or controlled process. I have a human in place that takes those inputs and those recommendations and makes the final decision. Right. I mean, so, and I think given sort of that fencing, there's still a huge amount of productivity gain. We looked at user stories around cell gene therapy manufacturing. Right now, there's a big growth in autologous, and we sort of looked at some of the challenges in there where you're building something, you're building a batch for the first time. You have a model for what it should be like, but you don't know what the growth yield will be. You don't know how catalyst, reduction happens. You're sort of coming off a model, but using that data and letting AI even help you and guide you in some of those production areas is really interesting. It can translate into a lot of productivity gain, money, cost reduction. But at the end of the day, it has to be a human saying, okay, I'm halfway through this batch. I'm going to reduce this catalyst by 10% and turn the temperature up 2%. Those are recommendations AI can give me, but it needs to be a human doing that the whole time. So that's I think one, sort of third big area of concern. And then I'll say the fourth area is just looking beyond the current sort of wave one set of AI, sort of things that you can expect to come out. And by that, I mean, next 12 months, maybe 18 months, wave one types of things around productivity, or around combining and getting your data into a place where you can start to get recommendations out of it. Wave two, we believe at Merit, wave two will be significantly about AI as intelligent agents with permission. And when we get into wave two, then you're thinking about things like, I need to procure this new raw material. It has sort of 80 different specifications related to it. I am giving an AI agent the ability to go out to a vendor community and query it with these 80 specifications and get, essentially the proposals on providing that to me, right? I'm giving it the ability to do that. Wave 2B is I'm giving it the ability to actually transact and procure that. On the other side, those vendors will have AI intelligent agents to say, hey, thank you for this inquiry. I'm running through all of my ERP data, my inventory, my capacity. What have I produced that's similar to this? I'm pulling that information together and giving you my bid. I'm giving you my proposal to provide this to you. That's just one, AI as agent scenario to think about that relates to us, right? So we think wave two is sort of 18 months out to 3 years out, that we'll be seeing business commerce move significantly to AI as agents. And getting ready for that's important because that's not that far out. It's moving very fast. So we think that getting into the right environment where you're implementing these wave one capabilities, but setting yourself up for a wave two scenario, scenarios is going to make a big difference in market share and success for most companies. So, yeah.
Yeah, no, absolutely fascinating. I mean, I knew we were going to get into some deep areas, and there's so many more questions that we haven't even touched about research and development as a topic. I think we might need to file that one for another day. But I think what's really come clear about this is that whilst yes, there are some concerns. The FDA is kind of it's not quite sure of what the right way to move on all of this necessarily is, but putting all of that to one side, there are some really pragmatic and useful things that are coming out, like as you just described, with wave one approaches, what can be achieved is some massive productivity gains. Wave two just going to accelerate that even more. So I think hugely exciting time. Bill, I really do appreciate your time with us. So I look forward to resuming the conversation very soon with you.
I do as well, Matt. It's always a pleasure. Thanks for having me on. And yeah, we have more to talk about on this topic. So we will.